Good evening, friends. Welcome to the PANSIGHT webinar. Today's topic is wrong diagnosis. Why? I have put 3 question marks, not 1. Why? That is what it means. How common is this misdiagnosis? Wrong diagnosis is misdiagnosis. Is it uncommon? Is it common? Or is it very common? In the chat box, just type in. I want to know, so that I'll be able to know your thinking. Very common. Venugopal, very common. Often very common. Anthony Puthenberg common. Okay, thank you. So very common. And we are going to look at the numbers now. Before that, I would like to say something about myself. I intend to share 50 years of experience and knowledge gained from practicing medicine in India, United Kingdom, and USA. I started practicing medicine in 1974. And I had the opportunity to take care of thousands and thousands of patients in India, United Kingdom, and USA. It's not a small number. So I had the opportunity to first-hand experience of seeing this one, the misdiagnosis. My webinar is based on FAQ, facts, experience, quotes. It doesn't make any sense to give a talk without facts. Yeah, I have 50 years of experience, so I think, no. 50 years experience, yeah, that is a fact. But what other numbers do you have? I have to provide the evidence, verifiable facts. First, the definition of diagnosis. The art or act of identifying a disease from its signs and the symptoms. The word signs and symptoms. Do you know what a sign means? If you don't know, put N in the chat box, so that I will explain. I don't want to assume that everybody knows what a sign means. If you don't know, put N. And I will explain what a sign is. N, N. Only one person doesn't know what a sign is. Okay, I'm surprised here. Okay, okay. A symptom is what a patient says. Symptom is what a patient says. Sign is something what a doctor or a nurse, they find out. For example, the patient comes and says, I'm having headache. I'm having a headache every day morning. That is a symptom. And he doesn't know why. And during the examination, if the nurse or the doctor finds that blood pressure is 200 millimeters, that's a sign. Then you connect the sign and the symptom. Then you form a diagnosis. Is it clear? If it is clear, put C in the chat box. Sign and the symptom. When you go to see a doctor, the doctor is trying to find out the sign. He heard the symptom. Then he wants to see that sign and symptom, they match, so that you can make a diagnosis. For example, I'm losing weight. I have lost, say, 5 kilograms in the last, say, 1 month. That is a symptom. And the doctor examines and he finds a tumor inside the abdomen, a liver, enlarged liver. So that is a sign. Then further investigation shows it's a liver cancer. Got it? So that is what it is, symptom and sign. Okay, There are numerous headlines. I have just taken a couple of them. More than 7 million incorrect diagnoses made in US emergency rooms every year. Government report, public health report. What is the population size in America? Around 33 crores. About India, more than 4 times, more than 140 crores. So imagine the number. Millions and millions. And here in USA, in spite of the fact, I worked in an emergency room for nearly 16 months. So I know. And we still get easily some 20 to 30 minutes to see one patient. What about in our country? You go to a casualty. How many minutes the doctor gets to see a patient? Put a number in the chat box, my dear friends. A number. 5 minutes, 10 minutes, 15 minutes, 20 minutes. Give me a number. 5. Sanal Kumar. Santosh PS. 3 minutes. Dr. Santosh PS is Dr. Santosh. And 5 minutes. Okay, Ravindran, 10 minutes. I don't know. Ravindran ji is hospital. I'm really surprised. But Wanankara Murele, are you allowed to doctor that you both? Okay. So today, before the talk, I contacted one ENT surgeon, very popular ENT surgeon in Trivandrum. He worked in the government sector before, Patanapuram Hospital, Taluk Hospital. Now he's having his own practice. I asked him, how many patients did you used to see when you were in the government service? He said that in 5 hours, he had to see nearly 400 patients. 400 patients in 5 hours. Then I contacted another friend. His name is also Srikumar. He's a pediatrician. He also worked for the government sector in Cheraingir, Taluk Hospital. Asked him, how many patients? He said nearly 300 patients in 4 to 5 hours. 60 minutes, 5 hours means 300 minutes. And you are going to see 300 to 400 patients? 1 minute? Then how do you manage? If a patient appears to be very sick, then I usually prioritize. I spend some 4 or 5 minutes. That's all. Other patients, the moment it comes, okay, symptom, that's it. I asked him, do you find time to listen to? This is authentic data. When I worked in the Trivandrum Medical College, 40 years back, outpatient department, once a week, 8 to 11, 3 hours. I used to see 40 to 50 patients. So that means, say, the 3 hours means 180 minutes. 40 to 50 means less than 5 minutes. So, the possibility of wrong diagnosis is high. Are you convinced? If you are convinced, put a C in the chat box. If you are convinced. When you take a car, if you are having a car or a problem, to a workshop mechanic, do you think that he makes a diagnosis in 1 minute? He spends easily some 10 to 15 minutes. Or a computer also. The computer is sick. It is not working. You take a technician, he will easily require some 10 to 15 minutes. Am I right? If I am right, put R in the chat box. Put R in the chat box. Computer, I'm sure that you have. And if you have a smartphone also, a problem, it is not working well. That means it's sick. It is sick. They take that much time. But your patient, 3 to 4 minutes? No way. And in USA, minimum you get 15 minutes. Minimum 15 minutes. To 15 to 30 minutes. In spite of that, in spite of getting 15 to 30 minutes, you saw the number, misdiagnosis. So, India, definitely, we don't have the authentic data. Misdiagnosis cost the US 800,000 deaths and serious disabilities every year, study finds. Medical errors may result in more than 200,000 deaths. In this context, I would like to say 3 real-life incidents. I can talk on this topic for 20 to 30 hours. Hundreds of real-life stories, but we don't have that time. When I was a house surgeon, that was in the 1974, a teenage girl, she went brain dead because of misdiagnosis. That is almost 50 years back. What happened? The girl was brought to the casualty around 11 o'clock. She didn't wake up even after 10 o'clock. Usually she used to get up in the morning by 7 o'clock. And the parents, they thought that she's sleeping. Okay, let her sleep. At 10 o'clock when they tried to wake her up, they found her unconscious. She didn't have any significant health problem. I used the word significant health problem. But she had some health problem. And they brought her to the casualty. So, part of the investigation, unconscious coma. From the spine, take the CS of that, cerebrospinal fluid, by putting a needle and take the needle, they take the fluid and send it to the lab. I'm talking about 50 years back. Even now also, I don't think that the government hospital, the labs, you can get the results just like that. So it took 3 or 4 hours for the results to come back. When we got the results, the sugar level in the CSF was very low. We are looking for infection, whether it is meningitis. But everything was clear. No cells, no pus cells. But the sugar level was low. Huh? Why? Then we immediately drew the blood also to see the blood sugar. Blood sugar level was around 40 milligrams. You know, high blood sugar we call hyperglycemia. Low blood sugar we call hypoglycemia. And the hypoglycemia is more dangerous. And the hypoglycemia, if it is left untreated for more than 6 hours, it can cause permanent, irreversible brain damage. I use 2 words, permanent and irreversible brain damage. So that young girl, permanent, irreversible brain damage. Then again, we were wondering why the blood sugar level went down. Then we asked, is she taking any medication, any drugs? Yeah, yesterday she went and we took her a doctor and she was having heartburn. Nenjerichil. And he gave some medicine. Okay, can you bring that medicine? Then they went home and brought that strip. What did we find? It was a medicine for treating diabetes. She didn't have diabetes. What happened? The doctors, I really at times feel angry because of the illegible handwriting. He wrote Diavor, and the medical store, that guy, he thought it is Dionyl. Diavor, Dionyl. So he gave Dionyl. Who should be blamed? Who should be blamed? Doctor. Am I right? For writing a illegible prescription. And number 2, that's where this talk, today's talk purpose is that the patient and the patient's family members, please, you have to bring all the information, any medication the patient taking along with you when you go to see a doctor. That is a take-home message. If they had brought that one, then they could have timely intervention. That happened during my house surgery day. Immediately I started writing any prescription. They say, somebody is messing up with my presentation. Okay. Immediately I made sure that I would write any prescription capital, no cursive writing. And after I became a tutor, I always used to insist the house surgeons who were working under me to write any prescription in capital letter. But these days you don't have to worry a lot because electronic, many computer based. So when you take a printout, the handwriting illegibility is not going to affect much. So that is one incident. Is this story from this story? I'm sure that similarly, hundreds of people must have developed hypoglycemia, especially diabetes management. I'm really scared of the so-called the endocrinologist, the specialist. My own father, when he was in a hospitalized, I was in America. He was having a diabetes well controlled with a half a tablet oral medication. And he developed pneumonia, so he was admitted. And when you are having pneumonia and you are in the ICU, obviously, till the infection is controlled, they have to give insulin. So he was given insulin. And after 5 or 6 days, everything is stable and he was about to be discharged. And the endocrinologist who came and saw my father, he prescribed insulin pen. Insulin pen. Why? They get kickback. Penicillin, the greed. Many doctors, you have to be extremely careful. Insulin pen. And when I asked my nephew after discharge, what are the medications? He told me, insulin pen. I said, what? Insulin pen? He doesn't require any insulin. Yeah, infection's over. Restart the tablet. Oh, my nephew, he wouldn't believe me. He is my uncle. So he was not seeing me as a doctor expert. He told me, vaangichu kazhinju. I said, how many units? 10 units every day. No. I asked him, give 6 units and tomorrow morning near our home, Nandavanam, that's Valsala nursing home. Get a nurse and come the blood sugar, check the blood sugar. Give 6 units and fasting blood sugar. Next day when it checked, it was 70 milligrams. My father was 84 years old. And I told him, no, reduce it to 3 units. 3. On the next day, it was 84. I said, that stop. If I didn't intervene, imagine the situation. If my father didn't have a son like me who is a medical doctor, if I didn't intervene, they would have given 10 units. Next day, the blood sugar would have gone to some 50 or below 50. And you would have been sleeping or unconscious. Then imagine, is it scary? If it is scary, put S in the chat box. Scary. Is it scary? Yes. So this is a real story. This happened in my own home. So I'm really afraid of many of these specialists in India. Most of them, they are not there to practice medicine. They are trying to make money. It has not become a service profession. It is a business, pure business. That is one of the reasons. In 2009, when my father had some illness, there again, because of mismanagement, while he was in the hospital, he developed diarrhea. Most probably they must have given some antibiotic unnecessarily. He developed diarrhea. And they didn't manage the diarrhea in the right way. They didn't give saline, glucose saline. They gave him just glucose. Then even drowsy. Drowsy means. And they discharged him after 3 days. I was in America. And I asked my mother, how is he doing? Oh, he's sleeping. Okay. And next day also I asked him, how is he doing? He's sleeping. I thought, why? He should not be sleeping. Then I asked a friend of mine to go and see my father, who is a doctor. And he examined and he ordered for some tests and he found that sodium level was gone down, hyponatremia, low sodium. Then he was admitted in the hospital, they was given sodium to correction. By then, it has done irreversible damage. His whole personality changed. A man who was very active, energetic, used to watch TV news, read newspaper, lost complete interest. He lived for another 5 years, losing all interest. That is one of the reasons I resigned my job and I stayed back. I am really afraid of more than the illness, doctors, and the multi-specialty hospitals. They are there to make money. I'm giving the facts. I'm not worried or I'm not afraid because I'm a person, I always try to speak facts, truth. So I couldn't save my dad. I couldn't save my dad. And before that, I was able to save my mom from a misdiagnosis. 1977, she had a small lump in the breast. I was at that time doing a post-graduation, MD. And when I examined a small lump, okay, took it to the professor of surgery. Is it breast cancer? Radical mastectomy. That is, remove the total breast, the muscles, glands, everything. 100% you are sure that is breast cancer. Then after that one, he says, okay, then chemotherapy or radiation. At that time, Dr. M. Krishnan Nair, he is no more. He is no more. He's RCC. He was the director. At that time, there was no RCC. He was working in the medical college. I approached him because I want to know what should be done after this surgery, chemo or radiation. And he examined my mom. He said, Venu, എനിക്ക് ഇത് ക്യാൻസർ ആണെന്ന് തോന്നുന്നില്ല. എനിക്ക് ഇത് ക്യാൻസർ ആണെന്ന് തോന്നുന്നില്ല. Why don't you do this way? Ask the surgeon to take a biopsy and get a frozen section, examine the pathology. And if the frozen section reading shows cancer, then go ahead, yeah, mastectomy. If it is not, then close that biopsy site and wait for the report after 1 week. Then if it is cancer, then go for it. Otherwise, don't do it. And I got, and the professor, he was nice. He listened to me. He said, sir, could you please take a biopsy and I'll take it to the stress into the pathology. And I took that one within 20 minutes. There was no cancer cell. So breast was not removed. 1 week later, the regular report came. It was not cancer. Otherwise, what would have happened? Total deformity. How damaging. A woman with one breast and a whole side gone. Misdiagnosed. I was able to save my mom. I was not able to save my dad. So all the more, can you appreciate the reason that is this topic, wrong diagnosis, is close to my heart? Are you convinced? If you are convinced, put C in the chat box. This has happened not outside, somewhere else. In my own home. I'm a doctor. So I resigned and stayed for, I thought my father he was at that time 85, maybe he may live for another 1 or 2 years. I said, okay, money is not, I was never motivated by money. So in USA, if you work every year, yeah, you can make a lot of money. I'm not going to tell exactly how much. I resigned the job. My father lived for another 5.5 years. I was in Trivandrum. Money, no. But I'm able to sleep without any feelings of guilt or regret. During those 5.5 years, I managed all the illnesses. He had fever, okay, I'll take care of cough, okay, diarrhea, or constipation, or blood in the stool. I was able to examine, I was able to evaluate. No antibiotics for most of the time. No antibiotics. To be frank, I didn't give antibiotic at all whenever he had cough or viral infection. So that is what it is. There are plenty of books on the wrong diagnosis or misdiagnosis. I've shown you a couple of titles. 3 types of misdiagnosis. Incorrect diagnosis, that is the wrong diagnosis. When the diagnosis is wrong, obviously the treatment will be wrong. The diagnosis is wrong, treatment will be wrong. Simple. So that is what is happening in some cases. Failure to diagnose, failure to treat. ഒന്നും കുഴപ്പമൊന്നുമില്ല കേട്ടോ. After exam ഒന്നും കുഴപ്പമില്ല, പേടിക്കണ്ട കേട്ടോ. വീട്ടിൽ പറഞ്ഞേക്കും, ഒന്നും പേടിക്കണ്ട. You have failed to diagnose and you don't treat. That also is plenty of cases. Then comes delayed diagnosis, delayed treatment. രണ്ടു ദിവസം കഴിഞ്ഞു വരട്ടെ, പിന്നെ നോക്കാം. You are not doing the right type of investigations, examination on the spot and make a diagnosis. You delay. Dangerous. My dear friends, this slide, the contents, it is not from any textbook. I have not cut and pasted something here. It's based on my own experience based, that one. It is original, that slide. Original. Eight reasons behind misdiagnosis. Again, original, my own. Miscommunication. I'm going to give a talk next week. The talk title is Communication Failure. You must have heard about heart failure, kidney failure, liver failure. Communication failure is the mother of all failures. Mother of all failures. Heart failure also, if the doctor does not explain well, give the advice easily understandable for the patient won't follow the advice, instructions. Failure. Heart failure will get worse because of the communication failure. Am I right? If I am right, put R in the chat box. How often do you find a doctor explaining things clearly? How often? Majority of doctors, especially in India, they are poor communicators. In USA also, significant number of them are poor communicators. That is where I was able to get many compliments, written compliments from patients. And Dr. Reddiar, he explained everything. I was able to understand clearly. So miscommunication. Inexperience. When I say miscommunication, patients also don't think I'm not here to just point the finger at doctors only. Patients, they're bystanders. Most of them, they are responsible for misdiagnosis, my dear friends. Today's talk, I'm going to put more emphasis on the patients. You cannot change a doctor, but you can help a doctor make the right diagnosis. Inexperience, yeah, young doctor, house arranged days. Yes, I also made some wrong diagnosis, but nothing bad happened because house arranged, there's somebody to supervise. When you make a diagnosis, we have to present the case, discuss with the or assistant professor or associate professor. They say, oh, is okay. Did you check this one? Did this one? And they correct you. That's why the purpose of house orientation is to, when you're putting the theory knowledge into practice, your inexperience, somebody is monitoring you. Here also in USA, 3 years of residency training. 3 years, just like the MD there. I had to go through the 3 years of residency training here also. I have to present the case every day to the consultant. Then they'll ask, why do you think that one? Then I have to convince the consultant that my diagnosis is based on facts and evidence. So young doctors, they make many mistakes. Incompetence, obvious. These days, and especially now, it is very, very worrisome. There are plenty of private medical colleges. Sudhanji, you know, plenty of private medical colleges. Plenty. They are there to make money, right? Profit. 50 lakhs to tuition fee. Just a tuition fee for 5-year course. 50 lakhs to 1 crore 25 lakhs in Amrudanandamai AIMS Hospital. 1 crore 25 lakhs just for tuition fee. Not for food or hostel, other things. How do you explain? Yeah, you must have seen advertisements. China, medicine, 20 lakhs. Come here, 20 lakhs. Hostel accommodation, food, everything, 20 lakhs. Ukraine, yeah, 20 lakhs. Plenty of people are going there. How come? Here you have to pay 50 lakhs this one, there 20 lakhs, 25. Because you will get the degree. You will get the degree, not the knowledge or not the competence. Is it clear? If it is clear, put C in the chat box. I'm making it easy to understand. So they come back. That is why the government of India, they are not competent. They have to pass one examination before they could get registration. That examination, only 10% of them they pass, clear that examination. 10%, 90%, no. So when they come, when they don't pass, what do? They already spent some 25 lakhs, wasted 5 or 6 years. They don't have any, they cannot practice here. They become physician assistant, my dear friend. All these hospitals, they hire them as physician assistant, clerical job. They go along with the doctor, write down the notes, and they check the blood pressure or vital signs. That also I witnessed this incident in one of the corporate hospitals in Trivandrum. My friend, who is a cardiologist there, he was treating a patient with high blood pressure. The patient was already on 3 medications. And the blood pressure reading came back as 160 or 100. I was sitting there. And he asked the patient, are you taking medicines? And he was a retired college professor. So my friend, he is a person, very rational thinker, the cardiologist. What did he do? He didn't increase the dose or he didn't add this one. He himself went and checked the blood pressure. Now, what was the blood pressure reading? It was 130 or some 80 or 82. It was recorded as 160. That is incompetence, the point of that young doctor or physician assistant. And he called that person. I was watching. I was there, witnessing the whole situation. And he asked her to recheck the blood pressure. And she rechecked again. She said 160, 100. And after she left, he looked at me, Reddy, ഞാൻ തോറ്റു. ഈ ചൈനയിൽ നിന്നൊക്കെ വരുന്ന ഇവരെ കൊണ്ട് ഞാൻ തോറ്റു കേട്ടോ. അപ്പൊ എല്ലാം ഞാൻ തന്നെ ഒന്നുകൂടെ ചെക്ക് ചെയ്യേണ്ട ഒരു ഗതികേടാണ്. I myself have to check everything. I cannot trust their competence. My dear friend, this is a vast topic. Are you finding it so interesting? If you are finding it interesting, put I in the chat box. If you are finding it very interesting, put VI. And insightful. Then in that case, today I'm not going to complete whatever I wanted to say. Because unless I explain more, I don't want to rush through. So this will make this part 1. And we will have this very same session, part 2 next week. Is it okay? If it is okay, put okay in the chat box. If it is okay, put okay in the chat box. Okay. Okay. Thank you. Because you might never have heard a talk like this given by a doctor with all qualifications. Am I right? Have you ever heard anybody giving with authentic, factual information? Dr. Hegde, he talks something. At times 50% is right, 50% he talks nonsense. 50% right, 50% nonsense. I have heard. I have listened to some 3 or 4 talks. Something is wrong. That he is 84 years old. Something is wrong. Then comes high workload. That is where I told you. Here when I was working, 6 hours from morning, my work duty is from morning 8 to evening 4:30. With a lunch break of 30 minutes, 8 hours. 1 hour administrative time for all the paperwork, everything, 1 hour. So 7 hours. How many patients did I used to see? Never more than 20 patients. Never in the federal government hospital. In the private sector, they may see maybe 25. Why am I saying this? Even this 20 patients here, some doctors and workload is high. They are blaming workload, job burnout, stress. What about India? Today I talked to my friend who is an ENT surgeon, a busy practitioner. ഞാൻ ചോദിച്ചു എത്ര പേഷ്യൻസിനാണ് നോക്കുന്നത് ഒ പിയിൽ? വേണം ഞാൻ ഒരു 3 മണിക്കൂർ ഞാൻ നോക്കും. My OP is, otherwise I have to go and do surgery. 3 hours of OP. I see 40 patients. So that means in an hour, how many patients? Nearly 13 patients in an hour. I see how many patients? Less than 20 patients in 7 hours. You can understand the workload. The government hospital, unimaginable. And here again, patients, I am going to put the whole blame on, significant blame on the patients. For every trivial symptom, they immediately go to hospital. I told you, fever. When there is fever season, flu season, my friend told me in the primary health center, nearly 200 people will be standing in the line for fever. 98% of the people with the fever, they don't need to see any doctor. They don't need to go to any hospital. Most of them simply rest, kanji, bread. In 2 days' time, everything will get cleared. Anxiety, Prabuddha Kerala. They immediately worry, panic, dengue, self-diagnosis worry. They make the differential diagnosis. Dengue or chikungunya or H1N1 or whether it is COVID. Now comes the monkey fever. They immediately go to the outpatient. So this doctor who is sitting there, he has to see some 200 patients. And he may miss the diagnosis of some serious illness. Somebody may be having the serious fever, he misses. Is it clear? Is it understood? If it's understood, put you in the chat box. So I am pointing my finger on the public. You are overloading the system. The doctors are also human beings and the time is a resource. You need the time. They are not getting the time. Then what do? They rush through. Pania. They immediately prescribe. No examination. ഒരു മണിക്കൂറിൽ ഒരു 40 പേരെ കാണണമെന്നുണ്ടെങ്കിൽ is it possible? Gomarji, is it possible? Impossible. Mission impossible. ഇതിനെക്കുറിച്ച് ആരും ചർച്ച ചെയ്യാറില്ല. Have you ever seen anybody discussing these ugly, harsh realities? പറഞ്ഞു കഴിഞ്ഞാൽ ഡോക്ടർ എന്ന് പറയും, അതെന്തോന്ന് നോക്കണം, പിന്നെ വന്നു കഴിഞ്ഞാൽ നോക്കണം. അത് ഗുരുതരാണെങ്കിൽ സീരിയസ് ആണെങ്കിൽ എന്ത് ചെയ്യും? സുധോധനജി ചിരിക്കുന്നുണ്ട്. ഇപ്പൊ അതിൽ എന്റർടൈൻമെന്റ് ഉണ്ടല്ലേ? എന്റെ ബോഡി ലാംഗ്വേജിൽ കൂടെ ഐ എം ഏബിൾ ടു എന്റർടൈൻ യു, സം ഓഫ് യു. So high workload, impatience. A doctor, basic quality, that person must have patience. And these days, many doctors, they don't have any patience at all. They won't let you even finish what you want to say. They interrupt you. Even in USA also, studies have shown the doctors here, most of them, they interrupt a patient within 19 seconds. The patient is here, he starts telling something, in 19 seconds, they interrupt. Poor listening. When I came across that report, what did I do? This is what I did. And what happens these days with the computer screen? And I'm sure that if you go to some multi-specialty, doctor will be sitting and in front of him, there will be a computer. Am I right? He'll be looking at the computer. Am I right? If I am right, put R in the chat box. He'll be glaring at the computer screen. And the patient may be sitting somewhere there. And the patient will be saying, and he'll be typing in the data. No listening. So here what I did was, I wouldn't look at the computer screen first. When the patient comes, revolving chair like this. The patient was sitting there, turn around, okay, Mr. Harrison, how are you doing? Any new symptoms? Any new problems? And when he starts saying, I wouldn't interrupt for one whole minute, 1 full minute. Then only I will turn, get the computer. And the patients got immense satisfaction. I was awarded $1,000, rewarded with $1,000 for being an excellent listener. The patient said, Dr. Reddiar, listen. Dr. Reddiar, listen. All I did was, instead of 19 seconds interruption, 1 full minute. $1,000 I was rewarded. And by doing that one, the patient, they like me. They develop confidence in me, trust in me. Oh, Dr. Reddiar, listen to me. So whatever he is saying, okay, he listens, he knows what he is talking about. So it saved a lot of my time subsequently because they won't ask many questions. They're satisfied there. So, impatience. Greed. Because of the greed, all sorts of unnecessary investigations. And we have many. Some 40 years back, there was no DDRC, there was no metro. Now there is metro, chain, all that, and thyrocare. Am I right? Investigation. And they give some deal. Oh, this set, okay, you will get 2,000. This one is one. We'll give special discount of 200 rupees. Ah, okay. 200. മലയാളിക്ക് ഇന്ന് ഫ്രീ എന്ന് പറഞ്ഞാൽ മതി. പെണ്ണുങ്ങളായാലും ആണുങ്ങളായാലും ആ 4 ലക്ഷം വാക്ക് ഫ്രീ. ഇവര് ഉടനെ യെസ്. And when you do all the unnecessary investigations, there will be some results will be abnormal. And false positive results also very common. Then you have to do more investigation. You have to spend more time, money, and you start worrying also. The doctors, again, they get kicked back from the lab services. 20 to 30% kickback. Radiology, more than that, up to 50%. CT scan, MRI scan. Yeah, order all those things. So when from the patient, you may be getting a consultation fee of 500 rupees. But you order for the MRI scan, you may get easily some 3,000 rupees. Labs are the 500 or 600. So from that patient gave you 500, patient is not realizing. The very same doctor got some nearly 4,000 rupees from the labs. Is it shocking? If it is shocking, put yes in the chat box. I'm sharing the ugly fact. Because I know this for certain. The reason is, when I was in Trivandrum for 5.5 years, I was approached by one of the CT scan lab center guy. He is one of the managing, the directors. He told me, Doctor, you would have practiced here. Why are you sitting here? Why don't you practice here? I said, okay, here if you want to practice, then whereas in USA, I make easily, lot of money by ethical practice, by practicing. ഒന്നും മേടിക്കണ്ട ഡോക്ടറെ, ഞങ്ങൾ ഇവിടെ OP, we'll give you a consultation room and we'll get the patients also. ഒരു ദിവസം ഒരു 4 CT scan, ഒരു MRI scan, 4 CT scan, MRI scan ആകുമ്പോഴത്തേന് at the end of the month you will get nearly 2 lakh rupees kickback. Then consultation fee. And then he gave me a laundry list of doctors in Trivandrum who were getting that kind of a kickback. I'm not going to discuss the names. He gave me a laundry list of these, just to motivate me. He wanted to motivate me. Somebody say yes, yes, so I will go there. So I know it is unethical, greed. There's no drug medicine for greed. Okay, now then comes misinterpretation of results. Okay, you order the test, and many doctors, they don't even know how to interpret the abnormal lab result. They order it, then what they do? They immediately refer the patient to a specialist. Liver enzyme. Okay, 2 enzymes. I'm going to give you 2 names of enzymes. One is called HGPT, another HGOT. Normal range is 5 to 40. And if it is some 45 or 50, and the patients these days, Prabhuddha Karlam, they are literate. They know how to number abnormal. They get worried. Doctor, and എന്ത് ചെയ്യണം? ഒരു gastroenterologist ഒന്ന് കൺസൾട്ട് ചെയ്യും. ഞാൻ gastroenterologist refer ചെയ്യാം. So now the patient gets go to the gastroenterologist. When that normal, slightly outside the normal range is, has nothing to worry about. You don't have to worry about, suppose the average height of a person in Kerala, a man, average height is 5 feet, is 7 inches. I'm giving you an example. Now a person's height is 5 feet and 4 inches. Does it mean that he is abnormal? He should go and get some treatment? Or he is 6 feet, he is a 6-footer. The same way, the lab also, this one, slightly outside the range. No. But many people, they don't know how to interpret. In USA also, doctors, they don't know how to interpret the lab results correctly. My supervisor, she is also board certified. She is going to supervise me. Supervisor. I inherited her panel of patients because when she was promoted as the supervisor, I came and I took her panel of patients. Electronic medical records. So I went through, when the patient came, I looked at the previous results, the lab results, and I saw that this patient was having diabetes. The A1C was 7.2. And here we have to inform the patients about the lab results. If the labs are done within 24 to 48 hours, the doctor's responsibility to inform the patient about the lab results. And I looked at what she had written. The lab results are all normal. She was having diabetes. She didn't do anything about that. And very same person for another patient, his fasting blood sugar was 102. That is normal. Diabetes only if it is above 126. And she sent a letter. All the results are normal except you have a high blood sugar. It was 102. So, and she is my supervisor. I suffered a lot under her. Such a IAS person. IAS, I gave a talk on IAS, that is ignorant, arrogant, and stupid. Yeah? That is IAS. So, misinterpretation of results. Unnecessarily, back pain, the guideline is acute back pain. Don't do any investigation and wait for 4 weeks. Give the supportive, non-medical treatment, or if at all, give a ordinary painkiller like the Crocin or Calpol. They rush immediately for CT scan, MRI scan. And when you do the CT scan, MRI scan, do you know the radiation? One CT scan radiation is equivalent to more than 100 to 200 chest X-ray. Radiation is very harmful. People are not realizing that. Unnecessary CT scan. Then fragmentation of care. Do you understand what it is? If you don't understand, put N in the chat box. N, I will explain. Fragmentation of care. It was never there, Raichiranji. Never there 50 years back. 50 years back, my parents, again, they were under some care, one doctor. But here, many people, they have 3 or 4 doctors. One cardiologist, one neurologist, one gastroenterologist, one orthopedist. Am I right? From right, put R. Fragmentation of care. For each part of the body, you are going and seeing somebody else. There is no holistic approach. Thank you, Renaraji. So because of that one, the gastroenterologist goes and sees the patient goes and sees the gastroenterologist for Nenjerichal, Pulichiratal, or acid relaxation, heartburn. And he may prescribe one proton pump inhibitor called a pantoprazole, some brand name Pantosid. And subsequently, the patient goes for knee pain to a orthopedician. Orthopedist man a painkiller, and he also gives the pantoprazole a different brand name to protect the concern. Then goes to a cardiologist. A cardiologist gives some medication for his chest pain and the coronary one. Again, pantoprazole. So patient gets 3 different brand names, the same thing, drug overdose. It's not a safe medicine. And the pantoprazole overdosing, what will happen? There is no acid. There is no acid in the stomach. Acid, God is stupid. God put acid in the stomach, God is stupid. When there's no acid, you get many infections. Gastritis, many other infections. If you are seeing only one doctor, the fragmentations, you are seeing different people. See, most of the problems for acid heartburn, you don't have to go and see a specialist, my dear friend. Choose a general physician with an MD qualification. General physician, they can manage most of 90 to 95% of the health problems. Why the hell do you go to a cardiologist if you have got high blood pressure? You don't have to. You have digestive problem. Why the hell do you have to go to it? If the general physician subsequently, with the symptomatic management is not getting better, he may refer you for further investigation to a specialist. That's not what is happening. Agreed? Agree, A. This is my advice. Take home message. Subsequently, this video, when I upload, more than 100 people or sometimes 200 people, they watch this video. That's why I'm making those who are going to watch this video also. Remember, don't run to a specialist. I told you this story of my father, that endocrinologist, ordering insulin pen, 10 units. If he got that one, my father would have died or would have developed irreversible brain damage. Scary. General medicine physician, he will have total picture about your problems. One doctor, he knows, okay, what are the medications I have given. He will make sure that there's no overdosing. Okay, now I think the time is almost 9 o'clock. I told you this is a vast topic. Vast topic. So we'll have part 2 next week. Maybe sometimes we may have to do part 3 also. My objective is not, I'm not doing any of these things for making any money. I'm trying to, that is, donate my time, knowledge, and the skills for the benefit of the public. So the satisfaction I get is if I can save some people. Yes. Karmam, punya karmam. That's how we see this one. Okay, now I'm going to stop the recording, but we'll continue the discussion. During the discussion, you can ask many questions. Ask questions especially. And if you have some interesting story to share, that Dr. Santosh is here. And Dr. Santosh, I asked him to share one interesting, this one, when he was working in a hospital. Oh, I think he has left. Okay. So next week, Santosh is here. So next week, Santosh, I request you to join next week and share that story of misdiagnosis, what happened from the patient's side. I'm going to stop the recording. Stay there. We'll have discussion.